For years, Millicent McKinnon of Dallas went without health insurance. She was one of roughly 1 million Texans who make too much to qualify for Medicaid in the state, but too little to buy her own insurance. This was the situation until she died in 2019. She was 64 and had been unable to find consistent care for her breast cancer. Lorraine Birabil, McKinnon's daughter-in-law, says she is still grieving that loss. She was such a vibrant woman, she says. Just always full of energy and joy. Health insurance for roughly 2 million Americans is on the table as Congress considers a $3.5 trillion spending bill. This plan would extend health care coverage to people living in the 12 states that have yet to expand Medicaid to their working poor through the Affordable Care Act. If Congress approves the measure, those individuals would have access to a health plan through the federal government. This could be a lifeline to people living in Texas, where 17.5% of the population is uninsured, the most in the country. McKinnon was a descendant of runaway slaves who settled in Chicago. As an adult, she moved to Dallas and worked in healthcare her entire career. Her very last job was as a home health aide, taking care of elderly and disabled people. But McKinnon didn't make a lot of money, according to Birabil, and didn't get health insurance. And that's why, when McKinnon started feeling sick, she put off going to the doctor. She didn't have the coverage, says Birabil, an attorney who served briefly in the Texas House of Representatives. She was doing everything she could do to live a healthy lifestyle. And so when she realized that something was wrong and she went to find out what it was, it turned out that it was stage 4 breast cancer. In the year after her diagnosis, she bounced around hospitals,